If you have been waiting months to see a lung specialist on the NHS and your breathing is getting worse while you wait, this might completely change how you think about your options. I want to tell you about someone. Let's call him Brian. He was 58, retired, and started getting breathless just walking up the stairs in his own home. His GP referred him to an NHS respiratory clinic. The wait 22 weeks. By the time he was finally seen, he had had 2 chest infections, 2 visits to A&E, and had quietly convinced himself it might be something serious. But here is the part that matters. He shouldn't have waited 22 weeks to find that out. And you should not either. I will tell you why. Hello, I'm Dr. Suman Paul. I am NHS and private respiratory consultant based here in Liverpool. For over a decade, I have treated patients with asthma, COPD, breathlessness, persistent cough, and more complex lung conditions, both in the NHS and in private practice. In this video, I'm going to give you an honest, balanced breakdown of both the systems, the pros, the cons, and what it actually means for you if you are over 50 and trying to breathe easier and get answers faster. Before we go in any further, quick but important note. I'm a doctor, but I'm not your doctor. This video is for educational purposes only, not personal medical advice. If you are experiencing severe breathlessness at rest, chest pain, or blue lips, call 999 immediately. Those are emergencies. Now, here is a reality. Respiratory conditions like COPD, asthma, breathlessness, and sleep apnea are some of the most common reasons people over 50 struggle with their quality of life. And right now, the demand on NHS respiratory services is higher than ever. The Health Secretary, Wes Streeting, recently said it's now easier to book a haircut than to see a GP. And honestly, that's not far from the truth. This isn't the GP's fault. It's not the receptionist's fault. It's a system under immense pressure. And patients, especially those over 50 with worsening breathing symptoms, are paying the price. You might be thinking, the NHS is free. Why would I even consider private care? That's a fair question. And the answer isn't simply that private is better. It's more nuanced than that. But here is what concerns me. The average NHS wait to see a respiratory specialist in England is currently between 12 to 52 weeks. That's 3 to 12 months. And during that time, your lung condition doesn't pause. That's the part no one says out loud. Now let's talk about the NHS. And because I work in it and I genuinely respect it. Emergency respiratory care in the NHS is world class. Severe asthma attacks, COPD exacerbations, you will be treated and treated well. It also provides prescriptions, pulmonary rehab, and long-term follow-up at no cost. For complex conditions like lung cancer or pulmonary fibrosis, the multidisciplinary team approach is exceptional. But here is the honest part. The system is stretched. GP appointments are short. Referrals takes time. And when you finally get to the clinic, you may see a different doctor each time. Sometimes a resident doctor rather than a consultant. Sometimes not even a doctor. It could be a nurse practitioner or advanced care practitioner. That's not criticism, it's reality. And the waiting, that's the silent damage most people don't fully appreciate. Now, interestingly, when people in the UK choose private care, it's usually for orthopedics, eye issues, skin, gynecology, or oncology. Respiratory medicine sits in a strange middle ground. It's often not urgent enough for emergency care, but the wait for routine appointments can be very long. That gap is exactly where private care becomes relevant. Most of the patients I see privately aren't new to the idea. They have been waiting, their symptoms have been delayed or dismissed, and they want clear answers without more delay. That brings me to something I called the private clarity advantage. There are 5 parts to it. First, the continuity. You see the same consultant every time. Think back 20 years ago. You knew your GP and they knew you. They remembered your history. You didn't have to start from scratch at every visit. That's what private care brings back. When you book with me, you see me every time. I know your history. I track your progress. I notice changes early. That continuity isn't just reassuring. It's clinically important. Second, no GP referral needed. Most people don't realize this. You can book directly with a private respiratory consultant No GP letter, no waiting. If you want a specialist opinion, you can arrange it within days. Your GP is still important, but you don't need permission to get help. Third, booking that actually works. Right now, booking a GP appointment often means long hold times or competing at 8 am for limited slots. With private care, you go online, choose your time and confirm. It takes minutes, or if you prefer speaking to someone, you can call. A real person answers my clinic phone calls. They book you in. Simple, clear, done. Fourth, no parking stress or long wait. NHS visits often mean searching for parking, walking while breathless, and waiting well past your appointment time. In my clinic, you arrive and you are seen close to your slot because I control the schedule. Some patients need 20 minutes, others need maybe a bit more. I personally plan for that. Your time matters. And fifth, faster diagnostics. Tests like spirometry, pheno, CT scan imaging, or sleep study can take weeks or months through multiple NHS appointments. Privately, many of this can be arranged and reviewed much faster within few days. So your diagnosis and treatment plan come together in days, not months. Now, let me be completely honest about the downsides. Private care costs money. An initial consultation typically ranges from 180 to 300 pound depending on the specialty and the area. Test and follow-up cost extra. Insurance may cover it, but if you are self-paying, it's a real consideration. Also, private isn't better for everything. If you need emergency care, complex surgery, or multidisciplinary input, the NHS is often the right place. I refer patients back when needed. And private care does not replace your GP. Your GP remains central to your care. A good specialist communicate with them, and I always do. So to bring this together, the NHS is remarkable. It saves lives every day. But if you are over 50, feeling breathless and facing months of waiting, private respiratory care can offer something very valuable. Faster access, continuity, simple booking, less stress, and quicker answers. You don't have to choose one or other. Many patients use both and benefit from both. If you are wondering what to do next, it's straightforward. You can book online using the link in the description. Choose your time, confirm, and you are set. Or call the number on screen, 8 am to 10 pm, 7 days a week, and speak to someone directly. No referral, no waiting list, just a proper conversation with a consultant who has the time to listen. And if you're not ready yet, I have included a free guide below. 5 questions to ask a respiratory specialist before you book, so you can feel fully prepared when the time comes. If this helped you, share it with someone over 50 who's been putting off getting their breathing checked. It might make a difference than you think. I'm Dr. Suman Paul, and I look forward to helping you breathe easier soon. See you in the next video.